Hello everyone, welcome to RWD Vet Academic. This is Iris. RWD is a life science company focused on animal health. We have been founded for more than 10 years. We have a veterinary anesthesia machine, ventilator, dental unit, laser therapy, and many other best-selling products in the world. So we started RWD Vet Academic, hoping to provide more service and knowledge to our users. Now, please allow me to introduce the theme and lecture of this academic to you. Welcome, Dr. Lin. The theme of this academic is osteoarthritis and laser therapy. Welcome, Dr. Lin. And now let's Dr. Lin to introduce himself.
Okay, and I will, first of all, I will share my, okay, and good evening, doctors. And should I say good morning or good afternoon to some doctors in Europe or America? I'm not sure if there's any doctors from other than Asia. And it's a great honor for me to speak this webinar about laser therapy and osteoarthritis in dogs. Also, I would like to thank RW Life Science to make this webinar happen. And okay, and I would like to introduce myself first. My name is Shiyu Lin, and I am a CCRP. CCRP is a certificated canine rehabilitation practitioner since 2018, and I have worked in small animal rehabilitation field for about 6 years, and I got my DBM degree in 2012 and my master degree in 2014. And I have been working as a clinician in Taiwan, Kaohsiung, since 2016, and about 60% of my patients come to visit me for rehabilitation. And I think a lot of doctors are curious about what CCRP is. CCRP is a certification for vets and vet nurses who are interested in physiotherapy, and we have to do some like online courses and lab work, and we need to write reports and take exam to get the certification. And if you can Google CCRP, you can find more information. I think it's pretty worth it. Okay, then I'll try to introduce my practice, and this is where my office is. This is where I work. It's like a small playground for my patients, and I do the modalities in this area, including laser, electrical stimulation, and therapeutic ultrasound. Also, I do my manual therapy on the table as well, and you can see there are cavalities. I do the therapeutic exercise on the ground with my patients. And this is another room for the underwater treadmill. We got 2 underwater treadmill. One is the big one, and there's a small one. And the big one can fill patients for up to like 70 kilos. And the small one is about 20 kilos. Okay, then today I will introduce about physiotherapy first. What is physiotherapy? Then we will jump to the basic biochemistry about laser. And I know there are some doctors that has already heard these for so many years, so many times, but we will review some of these. Then we will jump to osteoarthritis and pain and see how laser can alleviate pain in our OA patients. And finally, I will show you some interesting cases. Okay, first of all, what is physiotherapy? Physiotherapy in human has been established after like World War II, and there were soldiers with disabilities due to the war. And the scientists have to find ways to make these patients' life better and to improve their life quality. And that was the time doctors started to introduce physiotherapy to medicine. And physiotherapy in dogs and cats has started about 20, 30 years ago. And so, the treatment of the disease, injury, or deformity by physio methods, such as massage, heat treatment, and exercise rather than by drug or surgery is physiotherapy. And nowadays, we can do all kinds of different physiotherapy in our patients, which includes like the thermal therapy or the cryotherapy, which is the easiest one that the owner can do at home. And there is like pulsed electromagnetic field therapy, and this is the CC loop, which can alleviate pain. Also, laser, what we're going to talk about today, and the therapeutic ultrasound, the shock wave, and the electrical stimulations. These are all the modalities that we use quite often. Okay, and this one is more like the active exercise, such as like therapeutic exercise. So like this, there is a little slope, and I try to make the dog to like put the front limb on the slope to try to bear more weight on the hind limb. And this one is the pretty much the same, but a little bit harder to train the core muscles. And this is the cat is not willing to go through the cavaletti. And this one, the massage and the joint mobilization, that we use our hands to like to alleviate pain or to get more range of motion of our patients, and also the underwater treadmill. And before we do any physiotherapy, we must remember that we need to have a definite diagnosis of the patients, because sometimes the condition can be worse when we do not have a clear view of the clinical signs. And each time when you're doing any physiotherapy, the patient should get better and better each time. If after 2 or 3 sessions, you have discovered or you talk to the owner that you think that the patient is not getting better, you really need to like reevaluate or re-examine the patients again. Sometimes, such as like the bone tumor or the ununited fracture, sometimes you can be blurred by these kind of condition. Because, for example, you should not use laser on a tumor, but sometimes the fracture is due to the tumor, and you might think, oh, it might be a united fracture, so you keep doing laser on the area, and sometimes this kind of condition might make the patient's condition get worse. So we really need to remember this. Also, the radiographic examination is a very good tool for us to have an idea what is happening to our patients, especially in osteoarthritis cases. And we need to remember that osteoarthritis can happen in multiple joints. So it is better to take x-rays on the affected limbs that we have suspected, especially in geriatric dogs and cats. Orthopedic and neurological problem can happen at the same time. So on the left x-ray, you can see here, we can see a very obvious fat pad sign on the joint, in the joint capsule, the increased opacity of the joint capsule, and this can lead us to a cranial cruciate ligament rupture. And the spine x-ray, we can see there are spondylosis of our vertebral body. Also, we can see hip joint osteoarthritis on this x-ray. You can see the hip is very bad, and which is causing pain and may cause limited range of motion of the hip. Okay. And during the rehab consultation, we can use a evaluation form to complete all the physical examination to make sure we do not miss anything. We can measure the muscle girth. We can evaluate the gait to see if there's if the lameness is bad or it's fine. And we can measure the range of motion of the joints. And finally, we can do our pain assessments. some dogs and cats will be very nervous in the clinic and during our palpation, and especially in cats, they would not show any signs of pain because they are just too scared. And I suggest that we can ask the owner to take some videos at home, and including like no more walk, trout, or like climbing up the stairs or jumping down from the stairs. And we can analyze their gaits with the owner to determine what we can do to treat their pets. And it is important to set goals for the patients, and we need to understand what the owner's expectations are, because sometimes they might think, oh, after several rehabilitation sessions, their dog or their cat can feel like can walk or to run like a 1-year-old puppy or one year kitten. They can jump out, but you need to let, especially in osteoarthritis cases, because osteoarthritis is irreversible. So you need to let the owner have know that it's not going to get like a young puppy. It's sometimes it's going to get worse, but we're helping them to alleviate their pain and to make their life quality better. Okay, so we're going to our main theme today. So what is laser? A laser is a device that emits a beam of coherent light through an optical amplification process. And there are many types of lasers, including like gas laser or like fiber lasers and much more. And nowadays we use the term like photobiomodulation therapy to indicate the laser therapy in physiotherapy. The old terms we use like cold laser or low level laser, but in this webinar, I will say laser instead of photobiomodulation. I think it's easier for all the doctors to understand. So lasers are classified for safety purposes based on their potential for causing injury to humans' eyes. Most laser products are required by law to have a label listing the class. For visible beam consumer list, there are 4 main classes. The first 2 classes, or like the first 3 classes, they are safer. They are relatively safer for eye exposure. And the last 2, like the 3B or the class 4 laser, they are hazardous. And this chart shows how the eye injury hazard increases as the laser's power increase. And we can see for the class 1 to class 3, it's like you can see these laser in our normal life, like laser printer or like barcode scanners. And like started from the 3B or class 4 laser, like industrial lasers or like medical device lasers for eye surgery or skin treatments. Just make sure you have to wear the goggles. And for the cats and dog, for the patients, I suggest or I recommend they can wear a goggle. They can wear goggles, but I know it's quite hard for them to wear goggles, but just try your best, or do not let their eyes see directly to the laser beam. Okay. And there are 4 things that can happen when laser energy hits the tissue. It can be reflected, it can be absorbed, it can be transmitted and scattered. And there's only about 20 to 40% of the laser energy can be absorbed by the tissue and causing the biological effect. When we are doing the laser therapy, I think it's better to part the patient's fur and let the probe contact to the skin for which to maximize the power absorption of the laser. Okay, so this is the picture that shows the photochemical effect of the laser therapy in tissue. Laser light with specific wavelengths like 670, 808, or 904 nanometer will be absorbed by the chromophores to increase the enzyme's activity, like the cytochrome C oxidase. And as a result, that three molecules are affected: the ATP, ROS, and the nitric oxide. And these molecules can facilitate wound healing and give more energy to the cells and transport oxygen and immune cells to the tissue. As we can see on the right, we know about ATP, which is like energy, and it can accelerate the healing process. The ROS, which is the reactive oxygen species, it has a positive impact on the cell repair and healing. And the nitric oxide increase the circulation, and it's a potent vasodilator, and it can transport oxygen and immune cells throughout the tissues. So this photo is what we can summarize the photochemical effect. Like, first is the enzymatic activation, then ATP will be intensified, which means the mitochondria would produce more energy. Then the metabolism of the cell will increase and ion channels can be activated. The increased ATP production results in a great amount of energy available at the cellular level. So we can see after 3 hours to 6 hours after you use the laser, we can see there all the biochemical effect, like the ion channels will open and they produce more ATP. I think this is kind of boring to some of the doctors. Okay. Then about the photothermal effect. We talk about the specific wavelengths of laser that can be absorbed by the tissue, and it can be absorbed by the hemoglobin, melanin, and water as well. So, and if the laser energy is absorbed by the water, heat will be generated, which calls the thermal effect. And in non-surgical therapeutic applications, the tissue temperature remain below 43 degrees Celsius. And if the tissue is exposed to heat higher than 43 degrees Celsius, for a very short time, the effect is reversible. So this means when you are doing the laser, when you are doing a laser therapy on your patient, you must make sure that the skin is not overheat, because if the temperature is higher than 45 degrees Celsius, there is a possibility that you might burn their skin. And this chart is what I just talked about. The heat below 43 degrees Celsius cause no damage and increase the biochemical reaction. So we want this kind of effect on our patients. However, if the temperature increases and the cell membrane permeability can be changed and the protein can be denatured and even tissue vaporization can happen, which means when we're doing the laser therapy and thermal therapy on our patients, the temperature would be a very crucial effect. I always tell my patient, the owner, when they're doing thermal therapy at home, I suggest them use a water pack, and their water temperature must be between 40 to about 45 degrees, because this is much safer than using like a hair dryer, because the hair dryer can there's a possibility that you might use the hair dryer and to cause the burning effect on their skin. Okay. And also the heat can induce the mechanical force, which can modify cell morphology and tissue texture. If the duration of the laser, if the duration of the laser is less than 1 microsecond, the thermal confinement is achieved, which are used in surgery, such as like tattoo removal or like the eye surgery, like the PRK. And if we use the long pulse, the duration is more than 1 microsecond, or it is the continuous laser. The effect would generate mechanical stress on the cells and inducing a biological response. So we can summarize that the therapeutic effects of laser into 3 categories. The first, the anti-inflammatory effect, then the anti-edema effect, and the analgesic effect. So the laser therapy can also help tissue repair as well. The production of nitric oxide causes vasodilation, which I talked about it before, and it increased the supply of oxygen, nutrients, and growth factor. The inflammation can be modulated and wound healing can be triggered. Wound healing can be triggered, also stimulating fibroblast migration and activation. So this is the picture from the RWD science. These are the effects, what the biochemistry has told us when using the laser. And these are the most important things why laser therapy has become very, very useful in small animal practice. Okay, then we're going to talk about pain. What pain actually is. And pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. This is from the International Association Study of Pain's definition. And it is also a multi-dimensional sensory experience that is intrinsically unpleasant and associated with hating and soreness. We can differentiate pain into 2 sections, like acute pain. We can also call a nociceptive or inflammatory pain. It lasts short and end up with healing. The acute pain is transient from nauseous stimuli, and these types of pain are pain with a purpose to protect and allow rest for healing. For example, when you do like when your patient finishes surgery, you want them to rest because there is pain, which is the pain make the patients to rest and to do the wound healing, which is good. On the other hand, the chronic pain is often spontaneous. It occurs without any identifiable stimuli, and it lasts longer than the disease's process. And it is important that we should control our acute pain in our patients in order to prevent the chronic pain occurs. So we can see from our chart here, when acute inflammation happens, it goes either way. First, it goes to a nociceptive pain, and your tissue heals and you restore to normal. But if you do not control your acute pain, it can cause a persistence factors of persistence pain and chronic tissue inflammation and cause the neuropathic pain, which is what we call the chronic pain. Then we talk about the osteoarthritis. So osteoarthritis is one of the most diagnosed disease in geriatric dogs and cats. And the primary cause is idiopathic, and it can also be related to development disorders or like joint disability and trauma. And the gross pathological changes are the thickened joint capsule, the inflamed synovium, articular cartilage degradation, and the formation of osteophytes. And osteoarthritis is a progressive disease, and it is irreversible, which we should tell the owner in advance. It can happen. and it can get worse. And mostly we have discovered that the osteoarthritis can happen in their shoulder, in their elbow, in their hip, stifle, and spine as well. Okay, now I'm going to show you some clinical signs of my osteoarthritis patients. And most of the time we can see they have joint pain, they have joint effusion, they have lameness, or like joint stiffness and decreased range of motion. So let's see the first video, and we can kind of guess that which part of these patients' joint it's painful. Okay, let's have a look. Okay, we can see this Dachshund should be very happy and should go for their treats, but this dog got osteoarthritis on bilateral hip joint, which causing the dog unwilling to stand and is not able to ambulate. Okay, so this is another one. We can see this cat, it's very painful on the front limb. We can see the head nodding walking gait, the head nodding gait, which indicates the front limb it's in pain. This cat has the carpal joint arthritis as well as the hip joint and the stifle. So this is a very old cat. He's about like 15 years old. Okay. Okay, let's see another video. Okay. It's not these two cats. There's going to be another cats going from the back from the door. You can see. You can see that the cat's left front limb is very painful. Then the cat's got osteoarthritis on the elbow as well as the carpal joint. Okay, this one. Problem. Okay, we can see this dog that the dog cannot walk really properly. So this dog is with multi-joint osteoarthritis due to the immune disease, the SLE. So there's osteoarthritis on the elbow, the stifle, the hip. So the dog is in a lot of pain. But this is after a few sessions of the laser therapy. The dog is able to stand, to like slightly walk, although the gait is not perfect, but the laser therapy works pretty well on this dog. Okay, so after we have confirmed that the patient is in pain and we should score their pain, and we use the CBPI, the Canine Brief Pain Inventory, which is a very good assessment for chronic pain. And after the assessment, we can start planning our pain control project for our patients. When we're treating osteoarthritis patients, there are 4 elements which are very essential. We want to maintain the patient's muscle strength and their quality of life, as well as the owner's quality of life and the patient's mobility and the pain management. So it's all these four elements are very important. But we're going to talk about the pain management for today. So how does laser affect pain? The laser can increases the secretion of the serotonin, the beta endorphin release, and increase the acetylcholine, decrease the bradykinin, and direct analgesic effects on the nerve. And the laser therapy on osteoarthritis, which increases like the nerve regeneration and promotes axon sprouting and melanin formation. And it increases the cartilage production by increasing the chondrocyte and collagen production, and increase the bone formation by causing proliferation of the osteoblast to accelerate bone repair. So we can use laser on a lot of different diseases once you have a definite diagnosis. And this is a paper that has been published. It's a randomized blind placebo-controlled trial investigating the effects of photobiomodulation therapy, which is the laser on canine elbow osteoarthritis, and it does work very well when we are using laser on our OA patients. And there are also some contraindications of the laser therapy. First of all, just do not use it direct to the eye, and do not use it on malignant tumor. Do not use on pregnancy. Do not use on thyroid gland, and on seizures, as well as the epiphyseal plate. And I have some patients there with like, for example, they have a spleen tumor. Maybe it's a hemangiosarcoma, and they have their tumor removed. At the same time, they have arthritis on their hip joint or their staph joint. And the owner would question that whether we can do laser on these patients. My answer is yes, you can still do laser therapy on these patients. However, if your patient is with a mast cell tumor on the skin, and you remove the mast cell tumor, but at the same time, they have osteoarthritis or like other problem, maybe like the neurological issues, and they will ask your advice or whether you want to do a laser on them. My answer for this question is no, because there is a possibility that you might induce their skin tumor. As well as another question is like, I have a patient with seizure, and this patient has he also has a spine vertebral body spondylosis from T3 to L5. It's a puck, and he asked the owner asked me to whether they want to do whether I can do the laser for them. My answer for this patient is no as well, because first of all, we do not know whether why the seizures come from. So if you do the lasers, which may induce the frequency of seizures, which is not what we wanted to happen, because there is some other ways because to control the pain, like you can give him the pain methods. You can give me some pain control or other stuff. Maybe you can use hot pad. You can use thermotherapy on this dog instead of using laser. So I'm kind of like more cautious about seizure or like tumor patients when you are doing laser on these dogs and cats. Okay. Okay, we're going to jump to some case study. So the first is the obese case. So before this case, I just want to say that obesity affects canine osteoarthritis through increased mechanical loading and direct cell signaling and interaction with immune cells. So inflammatory mediators released from the adipose tissue, such as like cytokines, IL-6 or TNF alpha. So obesity leads to osteoarthritis, and osteoarthritis causes pain, which is a vicious cycle. So when I do my when I have some patient which is a bit overweight, we use the body condition score to score them, and it's better for these patients, and it's better for the dogs and kids to have the score around 4 or 5. If they're a bit of overweight, it's better to ask the owner to feed them less than, because obesity can lead to osteoarthritis. So this case, it's a pug. Its name is like Dodo, and it's a 6-year-old male. And so we can see that the owner have spoiled Dodo very much. So the dog is lack of exercise and leads to obesity and osteoarthritis. Therefore, Dodo is afraid to walk due to pain. So the movements are getting slower and slower. So we use laser therapy, and we do it like once a day and treat it for a week, and it's really getting better. And we can see this video. Let's see. The pug looks quite cute, but it's not a good thing to have a overweight dog and cat at home. Okay, so we're going to have our rehab cases. So this is our first case. The border collie's name is Coke, and she is 11 years old, and she presented with lameness for about 1 year, and the condition has gotten worse. So the dog came to visit me, and when I do the rehab consultation with the dog's right stifle is quite swollen, and there is crepitus when flexing the stifle, and the results of the drawer test is not very clear, but grade 3 lameness on the right hind leg is quite obvious. Then we do a X-ray. We can definitely see that on this ventral dorsal view of the X-ray of the right stifle, there are osteophytes formation, and the opacity of the infrapatellar fat pad has increased. Yeah, and this indicates that the cranial cruciate ligament rupture. And so the diagnosis of this of Coke is the right cranial cruciate ligament rupture, which is the chronic, and the right stifle osteoarthritis. So this is the first time when we evaluate the gait of Coke. We can see this video. We can see that on the right stifle, the walking gait is quite weird. Like is a bit lameness on the right hind limb, and we do a muscle girth measurement, and we can see the right side the right muscle mass is less then the right muscle mass is less than the left one. And my suggestion is there is pain on the right stifle, and which affecting the joint. So the dog is unwilling to bear weight on the right hind limb, so it leads to the muscle atrophy of the right. So I gave this dog some NSAIDs. I gave her some Varicocid before we do any rehabilitations. Then our goal for this dog is to increase the muscle strength and pain control. So this is another video I can see. We can see that in this video, the dog has difficulty when from the sit to stand posture. Okay, so we're doing our first rehab session. We want to facilitate the weight bearing and weight control, as well as the core muscle training. And we want to increase the muscle tone and muscle mass of the right hind limb compared to the left. So we do the massage, then we do the laser therapy here. So I always do the laser therapy at the beginning of the rehab session, because we know that laser has the photothermal effect, which is like we can like warm up those tissues, warm up those muscles before they do any therapeutic training. And then I will start to do some massage to release and to soothe their muscles. Then we start to do the therapeutic exercise and the underwater treadmill. So this is the first time that when the dog is doing the cavaletti. So we can see the gait is not very stable, because we try to let the dog to cross the cavaletti with a single hind limb. Apparently, the dog has a difficulty when doing this kind of exercise. Then we put the dog into the underwater treadmill, and I know the underwater treadmill is not today's course, but I still want you guys to know that why walking in the water and walking on with no water, they're different, because there's buoyancy in water, and there is also viscosity and resistance of the liquid. So when they're walking in the water, the water can help them to stand. First of all, this is the first thing. And secondly, there is resistance, which can train their muscles. Remember, when we are walking in the swimming pool, we can walk quite easily. However, we cannot walk very fast. So this is how we train the dog's muscle when they're walking in the water. But I think there is videos for this dog. So the dog walks quite well. It's not every dog walk like this for the first time in the underwater treadmill, because the owner told me this dog loves water. So I think yeah. So like walking in the water, compared to what we have seen in the previous video, you can see walking in the water is obviously easier than walking with no water for this patient. So the second rehab sessions, we want to, it's the same. We want to facilitate the weight bearing and weight control, and we want to increase the muscle tone. And the gait assessment, we think that the assessment has improved. And so we started to, after doing the laser, we started to do some slope training, therapeutic exercise, or like weave pulls, I can show you this video. Yeah. Okay, we can see that we try to let the patient's front limb on the slope, then which can let them bear more weight on the hind limb. Also, this is the second rehab session for the underwater treadmill. Oops. Yeah. Okay. Sorry. I just want you to see this. I add a little bit of slope in the underwater treadmill. We can see from this video. Yeah, you can see here. This is what I want to increase the weight bearing on the hind limb in the water as well. So we train the muscle tone and increase the weight bearing at the same time. Okay, so the third rehab session is where we do laser as well every time. Then we do the therapeutic exercise, and I gradually increase and gradually change the therapeutic exercise, like more and more difficult for this dog as the condition has getting better and better. Oops. Okay, so at this time, the dog's condition has improved. So the cavaletti is not a difficult thing for this dog. Then this is the underwater treadmill as well, and I have gradually increased the slope Okay, so this is the fourth time. The patients came to visit me like every week, so just 1 week each time, and I will give the owner some homework, such as like they can walk on the slope, they can do some thermal therapy at home before doing any exercise. They still can walk at home. They can go for walking. And they can do sit to stand. I asked my patient's owner to do some easy therapeutic exercise at home. So this one is go on. So this is the wave fold training. We try to let the dog have some weight shifting on their hind limbs. We can see that the dog is doing quite well. And another one. And yeah, and this one is the sit to stand exercise. Compared to the first video, we have seen that the condition has become better. So this one is the underwater treadmill for the fourth time. The slope is increasing. Yeah, okay. So the fifth time. So every time the dog is very chill when I'm doing the laser, and this is another therapeutic exercise. Underwater treadmill as well, and this dog has a few. I think the dog has like 10 sessions, but I just recorded the 6th rehab session because the condition has become better and better, and we do the observation. The muscle girth has been much improved on the right hind limb, and there is not much lameness we can see when the dog is doing like walking and trotting. This is This is a very difficult therapeutic exercise to train the hind limb, the front limb, as well as the core muscle. So this dog is doing very well. Okay, so from October of 2021 to December 2021, I just do some underwater treadmill for this dog because the dog has been getting better and better. Although there is slightly some lameness on this dog, but the owner is very happy about the condition, and also the most important is to control the dog's weight. Okay, so this is our case 2. So it's a 16-year-old male golden retriever. It's about 28 kilos, and the dog came to visit me because it got vestibular syndrome, and it has been diagnosed about 2 weeks ago, and the dog is unable to bear weight on the limbs, on all 4 limbs, and on the orthopedic examination, the hip extension has been restricted, and the draw test is not very clear. And the left hind limb, on the hind limb, we got very slow, conscious, proprioceptive reflex, and apparently the dog has the paraplegia. So we took an X-ray and we diagnosed it of like bilateral hip dysplasia. It got a T2 to L2 vertebral body spondylosis, but we think it might be a type 2 IVDD, as well as the vestibular syndrome. So the dog is in a lot of pain on the back and on the hind limb as well. So we want to do some pain control, and we want to build this muscle strength and gaining some range of motion for this dog. So we do a hot pack, we do a laser therapy, and we use massage and the passive range of motion for this dog, and we use the electrical stimulation for this dog as well, because this dog is unable to stand. So it's nothing. There's no active exercise that we can do for this dog. All we can do is to assist the dog's standing. So we do laser to paint. We do 1 month laser therapy and just a massage and electrical stimulation, and the dog is able to stand by himself in the middle of September, which is really good. Then when the dog is able to bear weight, we start to put the dog into underwater treadmill after all those like hot pack, laser therapy and massage. And this is the first time I hear. So this one is the first time when the dog is doing on the run treadmill. We can see the gait is not very, it's very uncertain, but I think it's good enough. Once the pain has been controlled, the dog would be able to stand and willing to walk. So pain control is very important. And this is the second. After a few sessions of the rehab session, yeah. Although the dog still needs some like assist standing on his belly, but this is a good sign for this dog. He's willing to walk, willing to eat, willing to ambulate. So this one is in October to December, we still do our goal is to control the pain and muscle strengthening and increase the range of motion as well as the coordination of the gait. Okay. Yeah. Yeah, so at this time, the dog do not need like a towel. We can just use your hand to help to like to push him a little bit on the hip. So in December of 2018, the dog is able to walk perfectly. So this is the video can show. Okay. So although the gait is a little bit atasic, like a little bit atasia of this dog's gait, but it's a 16-year-old. It's a Labrador. It got IVDD disease. It got IVDD. It got osteoarthritis. This is This is the owner is very happy with the results. Yeah. Okay, so I think we're ran out of time. So I just wanted to ask if there is any questions.
Thank you very much, Dr. Lin, for your wonderful talk. I'm sure you may have a lot of questions for Dr. Lin. And now it's time for Q&A. Please feel free to ask via Zoom.
There are some questions, I think, here. What is the proper order of applying laser and cold therapy? Which one is the first and second during the physiotherapy course? I think I have answered this question. You do the laser therapy at the beginning of your physio session. You can always start with cryotherapy or thermal therapy before laser, or you just do the laser, right? Okay, and do laser and do your massage, do your like therapeutic exercise or on a water treadmill after laser therapy. Okay, there's another question regarding what to use. So I'll just repeat these questions. Good evening. Regarding not to use laser therapy if a patient has a skin tumor, what if a mass or tumor removed is at the flank area at the laser therapy is only needed at the stifle, or it doesn't matter where the mass or tumor is, as long as there's a skin mass or tumor, then the laser therapy is not recommended for the patient. If the tumor has been removed and you're doing, but I think it depends on the tumor, like what kind of tumor it is. If it is like a really nasty tumor, such as like mast cell tumor, I would not use laser therapy, even though you have removed the tumor. But if it's a lipoma, I would actually do. I would agree that you can do the laser on the stifle, on the joints. I think it's okay to use if it's a lipoma. But if it's like a sarcoma or it's a nasty tumor on the nasty skin tumor, I would be cautious when we're doing laser therapy, because you never know. Maybe you can induce the chance of like the regrowth of the tumor. Okay. May I ask about epiphyseal plate? As you mentioned, we cannot apply laser at epiphyseal plate, but if in a case the young dog got broken leg at this area, we do applying laser or not. It really depends on where the fracture is. If it's on because the epiphyseal is on the like the distance or the proximal place of the bone. So if it's on the shaft of the if the fracture is on the shaft, I think you can use it, but just not directly on the epiphyseal place, because it might cause unknown like results. It might cause some bone issues when the dog is still growing. Yeah, there are some papers that I've seen, so I would not use it on. It really depends on where the fracture is. There's may I know how long frequency gap of water treadmill therapy? You mean like each time? The water on the water treadmill can be done like like every week, or like every week to twice weekly. Yeah. Will laser therapy affect heart? I don't. I can't answer this. I can't answer this question because I really don't know, because we do not. We do not use laser directly to a heart, but if there is a patient with a pacemaker, in we do not use laser therapy because there might be some bad interaction between the pacemaker and the laser. Okay. Can we apply laser for the burn skin? Yes. When there's a skin when there is like a wound on the skin, the laser, what we have talked previously, is that we can use um, the laser helps tissue repair, so we can use laser for the burned skin. So there's another question. Does all patients respond to the laser therapy? How long do you usually see results, fastest and slowest to show response? So I think pain control is like a multimodal. It's like a multimodal effect. Like you can use, like for pain, you can use laser. You can use your pain control medication. You can use hot pad, cold pad, and so in my opinion, with my patient with osteoarthritis, like one session or two sessions, or like, and it's the time between these sessions about 3 days, they can see a obvious in progression. They can see a very good effect on when we're finished doing laser therapy. I have some beagle patients with back pain, with front limb pain, with stifle pain. They Once I do the laser therapy, they're doing well, like straight after they went home, and the effect can maintain about 3 to 4 days. So for like chronic osteoarthritis patients, it's better for them to come to do the laser like twice every week. How long does it take to evaluate the effect since the therapy started? I would say about because when we're doing the muscle girth measuring, and when we're doing the range of motion measuring, it takes a lot of time. It takes a lot of time, and sometimes the patient will be exhausted when you are doing all these measurements. So it's I do the evaluation once a month, because when the muscle is growing, it's not going to be that fast. Like after 1 week, we can see it's not that obvious in 1 week. So I think it's better to do your evaluation every month. Okay, there's another question is there's I have one French bulldog with unknown paralysis of back leg, unfeeling pain with pain test. Can you help me to make a plain laser for the kid? Which positions should we apply laser? So it's a paralysis dog. So there's no feeling, there's no deep pain on the hind limb. I think you should do a CT first, because if it's because I have no idea if paralysis, it happens in a sudden, or it's gradually getting worse. But for French bulldog, there might be some deformity of the vertebral body, because French bulldogs spine, there always some deformity. So it might be, I think because I do not have an X-ray, so I think it might be a vertebral body, or like a vertebral I think it might be like a IVDD. But if the spine has been completely compressed by the bone, then I think it will be very hard for you to arrange any like rehabilitation sessions. So I suggest you can do a X-ray or a CT first to see whether if there is any deformity or the problem of flying. And if you want to do laser, yeah, I think it's really hard for me to tell you which position should we apply, should you apply laser. But yeah, I think we should see the X-ray first, and then I can answer your question. Okay. So how do you use to encourage your patients for therapy other than treats, as there are some dogs don't get attracted by food? Yeah, so luckily, a lot of my patients, they're quite interested in food. So that's why I do some like therapeutic exercises. This is the therapeutic exercises is especially for those who really like treats. And for those dogs who are not attracted by the food, we can still do some easy therapeutic exercise. We can do some weight shifting, such as we can make them standing on a peanut ball to make them feel uncomfortable, and they would do some weight shifting and to build their muscle strength. As well as we can ask the owner to help us, because sometimes dogs are always want to jump to their owner. So we can use owner to cooperate with us when we're doing the cavallari, or we can use some like a slope. We can hold them to stand on the slope, or we can ask the owner to help us. So yeah. So do you recommend the combination of laser and ultrasound therapy? Yes, because the ultrasound therapy works quite well as well. But the bad thing is the ultrasound therapy, you need to clip the hair of the patient. So we use there is some I have several hip joint patients. They have some, they do an FHO surgery. They cut their femoral head, and there are some muscle spasms on the hip joint. So I do laser first, then I do the I do the ultrasound therapy to release and to soothe their their surgical area. So yeah, I recommend the combination of laser and ultrasound therapy. Is there any precaution to use laser in patients with implants, such as bone planing and screw? I think it's I think it's okay. It's okay to use, because I have some TPLO patients. I still use laser and to scan their stifle, and there is no problem with it. So you don't have to worry about it. Is laser therapy similar to apply to laser acupuncture therapy? Well, when you're doing laser acupuncture, it's more like you're doing the trigger points. And because I don't do acupuncture, so but based on my colleagues who do acupuncture, I think there is some specific meaning when you're doing the acupuncture, like qi, or like release their muscles tension. So I think laser acupuncture works as well. I was still similar training before the NSAIDs. By similar training, that NSAIDs and lasers cannot be used at the same time. What is the reason? Medication? NSAIDs? I think it's when you're training before that, NSAIDs and laser therapy cannot use at the same time. But however, I use NSAIDs and laser at the same time. But if the patients got injection of NSAIDs or steroid in their joints, then you should not use laser for 7 days. It's okay. I have a lot of patients, they're taking NSAID pills and they do laser at the same time. So the only caution is when you're doing like a PRP, when you're doing an NSAID injection or steroid injection in their joint capsule, then you do not use laser for 7 days after. Yeah. How can we evaluate the effect of laser in patients with? Sorry. How can we evaluate the effect of laser in patients without? Sorry, I don't understand this question. How can we evaluate the effect of laser without obvious trauma? Without obvious trauma. When we're evaluating the patient, we use several, we use the CBPI, the pain evaluation, and we use the gait evaluation to see whether there is pain or whether there is obvious lameness on these patients. And if there is, we do an X-ray to find a definite diagnosis. Then we do the rehab session, then we evaluate again. Okay. So is it necessary to shave the hair before applying lasers? I don't think so, because that's what I have told what I've said, that we can part the hair. Although there might be some energy can be scattered, or there's some energy can be reflected due to the hair, but I don't think it's necessary. So when I'm doing laser, I'll try to spread the hair, part the hair, and like scanning, and to scan my probe. Okay, if the patient has swollen in mouth without any X-ray, is it possible to do as laser therapy? If yes, please. So swollen in the mouth without any X-ray result, because the swollen in the mouth can indicate maybe like melanoma, or it can be squamous cell carcinoma. So I think you should exclude these kind of diagnosis before you apply any laser therapy. How do you determine the frequency of laser therapy? How frequent the patient should come? Is it based on the pain level or the type of disease? Yes, it's based on the pain level. And for acute pain, for like the patients, they finish their surgery, like a MPL surgery or FHO surgery or TPL surgery, like orthopedic surgery. They can do laser like every day because it helps tissue healing, and the laser have the anti-inflammatory effect as well as anti-edema effect. So you can do it like every day. And if like today's topic in OA patients, just come every 3 days. I think it's good enough for this kind of patients, because you have to give time for those chronic tissue to recover and wait for those chronic tissue to heal. Which laser probe is preferable for OA cases, convex or flat probe? I think either will do, but my personal experience is I use a convex probe on my patients, and the sedative or tranquilizer or anesthetic necessary or can be given laser therapy, because laser therapy is not that painful. So I don't think the sedative or tranquilizer is needed. If they need any of these, how to manage to do the session, which are planned to be done or continuing this a few days. As I said, like when you're doing the acute pain, you can do it like every day, and you do like a chronic pain, you can do it every 3 days. But I do not think that the sedative or tranquilizer is needed in dogs. Sometimes if the dog is very, very, very excited, or they hate any like medical behavior, you can just put a collar on and ask the owner to hold him for you, and you can just do your laser. For cases like chronic gingivitis of FELV cat and FELG cases, can we use laser? Yes, I think yes, we can use. I have several patients use laser to treat their stomatitis or gingivitis. Yeah. Aside from medical view, is laser therapy should be expensive? What is the price range that is supposed to be? Somehow we have to convince the owner that is one of the good OA therapy for their pets, because some owners consider the therapy is quite expensive to them. Well, because for me, like in Taiwan, the price of laser therapy is not very expensive. It's like I'm not sure in other countries, but in my country, in Taiwan, the like one joint, the laser therapy, it's about like one area is about $20 US one joint, and you can make it like a session, like you can come like for 6 session, and you can have like a package, and you can charge the patient cheaper. So it really depends on you, but like because the $20 USD per section is not very expensive. So I think, and it works quite well. So I think it's you can make profit when you're using laser to treat a good OA therapy. Yeah. Okay, that's all the questions.
Thanks to Dr. Lin answer. Now it's our most exciting session. We will select 3 lucky winners to get instrument and ender tube in mask. The rules of the game are as follows. Viewers type RWD in the comments area. Then we'll take a screen shot after 5 seconds countdown. Now you guys can type RWD in the comments area. Okay, now let's wait for Dr. Lin to come down together. Come down 5 seconds. Now okay. Let's start it.
Okay.
5, 4, 3, 2, 1. Okay. Now we are ready to take a screenshot. We will record it and congratulations to the above lucky friends. Please contact us after live. The contact information in the email you can save the screenshots or leave a message through Facebook. Now we have a test of a webinar. Please enter the test through the link or QR code. After completing the test, you will get your e-certificate. You can save the picture and take a screenshot and save the information and contact with us. And this brings us to the end of today's academic. If you need more information, you can either send us email or follow our social media accounts as shown in the screen, and we will announce our next academic on it. Thank you very much. Thank you, Dr. Lin.
Thank you. Thank you.
See you.
See you. Bye-bye.
Bye.